The central venous line is an essential tool used in hospitals and outpatient care facilities. Unfortunately, IVDU patients often abuse their central line by injecting illicit drugs, resulting in deep infections, tragic overdoses, and exorbitant increases in cost of care. Medical facilities have an urgent and compelling need to inhibit the abuse of central lines. Introducing the Neuma Central Line Clamp, a simple single-use disposable. The clamp snaps shut and deters tampering. The line is now protected until the clamp is removed. Turn the knob to break open the clamp. Turning the knob to open the clamp breaks an internal mechanism so the clamp cannot be snapped shut again. If the patient removes the clamp, the broken clamp signals possible tampering.